We begin today with another sobering reminder that we are currently in the worst outbreak of the entire COVID era here in the state of Ohio. And this really two-year nightmare continues. Today's number of new coronavirus cases, if you're not paying attention, listen to this, is now a startling 12,502 new cases. That is the single biggest 24-hour number we have seen throughout this pandemic. Also, our most recent positivity rate, 23.8% by far. That is the highest positivity rate for a single day since tests have become more readily available. Then there's the issue of hospitalizations. The state reporting one of our highest single-day numbers of new hospitalizations, 584 new COVID-19 patients across Ohio hospitals. Although it is important to point out that the number of current patients in Ohio hospitals only went up by 4. It now sits at 4,797.
Well, we have crossed over into new territory, but it feels a little bit like a COVID deja vu today. So we have team coverage for you tonight to break it all down. Mark Namick will lay out the president's plan to get at-home tests to American homes. Emma Henderson spoke with hospital leaders about their plea to Ohioans to get vaccinated. And Isabel Lawrence talked with experts about the rise in kids being admitted to the hospital with COVID.
But first, our Brandon Simmons live at the drive-thru clinic in Cleveland, where crews today stopped accepting patients early this afternoon. Brandon, folks had to reserve a spot. How did this happen so quickly?
I know that's a very good question. We asked that question to officials. However, they didn't give us a definitive answer, only saying that they reached capacity and did have to turn some people away. Now, remember, it was just yesterday we talked about how difficult it was to schedule testing at area pharmacies, how hard it was to find those at-home test kits. And this was supposed to be a venue that provided some relief to that. However, it quickly became a mess right here in University Circle. I want to show you some of the video earlier. There were lines of cars on nearby streets really just waiting to get to the testing site here at the W.O. Walker building, where the Ohio Department of Health and National Guard were set up to conduct testing. But after just a few hours, as you said, the line was closed down and people were told they were at capacity and needed to come back another day. But here's where it gets really strange. Around 3 p.m., the line reopened to more cars after turning those people away because the line had died down too much. Really a bad situation for some of the people who had waited hours already and were turned away earlier in the afternoon. So I spoke to some people about why they were here to get tested, and we also heard from state officials about the importance of having a mass testing site open.
Oh, good, because there's no more appointments. The next available appointment, like at a Rite Aid or local CVS, is not till next week or the week after. So we just want to get tested so we can be around our family for the holiday.
These patients who are waiting in line today in the drive-thru were the patients that were taking up spots in our emergency room and our urgent cares, taking away the time that our doctors could focus on patients who were sick or requiring admission.
Now, I do want to point out that young lady I spoke to, she said she didn't feel any symptoms. They were just doing this as a precaution. That's why they were here in line. Now, even though people were turned away, I'm told the test site really did help relieve some of the strain on our healthcare systems that we were facing from so many people looking for tests. Obviously, there were clearly some issues here on the first day, but hopefully things do improve in the coming days. Now, in the meantime, people are being told to register for the event again tomorrow. They say that they also want people to look toward their pharmacies or go to more rural areas to see if there are openings there to find COVID tests, because they do expect long lines again. And also there are talks of opening additional sites like this on the east and west sides of town to help relieve some of the strain that we saw here today. Hopefully, Jay, these are just growing pains and things get better from here.
On one hand, it's good that so many people are interested in testing. It means that there is a general concern about either getting or transmitting this virus. On the other hand, the PCR tests we know are more complicated. What's the likelihood that those that test today or tomorrow, let's say, will even know the results of those tests before they gather with family for Christmas?
Right. So here's what we're told. We're told 48 to 72 hours for these PCR test results. Obviously, this testing site is being backed by our local healthcare systems who have laboratories on site. So they're saying 2 to 3 days. However, considering the number of people we saw here, there could be a backlog in those labs. I wouldn't count on it. I would say you want to try to find some of those antigen tests, those rapid tests, because you never know if these results will get back in time for the holiday. However, they are saying 2 to 3 days, Jay.
All right, understandable. The one thing that I would love to see a line for, vaccinations. We haven't seen that in a while.
Vaccines.
Hopefully the vaccine line will become a new thing once again. Brandon Simmons live tonight on What's New. Brandon, thanks.